to talk about pregnancy and pelvic floor. There's certain things that are going on there that massage therapists should know too. So when they come to us for musculoskeletal strain or pain, right? Oh, I already know that the co-contraction of the TA and the pelvic floor at the same time can increase, the stiffness of our SI joint. But in this case, well, look where her rectus abdominis is, and then her pelvic, is going back together, so it's already pinching in the SI joint, right? And then you have a lot of relaxin hormone in the body, which is meant for the pelvis to come apart and those joints to allow the baby to come through in labor, but it starts during pregnancy. And then we have the increased weight coming on top, right? And that weight being carried around causes stress on those joints and ligaments. And then like the third trimester, when the baby gets really big, that gait's going to change, and we got our external hip rotation, right? So that we're going to be waddling, and we have some trigger points that are going to develop in their gluteus medius. So here we can see the pelvic attachments in pregnancy too, and how the uterus now, look how big that is in this cross section, right? So all that is coming down on top of that bladder, and yeah, no wonder you have to go to the bathroom all the time. But we also have these ligaments, right? So we have the round ligaments here that come down. There's one on each side, and they attach right on each side of that pubic bone, right? Each side of the pubic symphysis. And we have the broad ligament that goes inside of the ilium. And then we have our uterosacral ligament as well here, which obviously goes from the uterus to the sacrum inside. And so all of that is going to be affecting the pelvic floor. And so there's a lot of low back pain involved, especially as pregnancy goes on. The pelvic floor muscles in the TA are the lumbopelvic stabilizers. So any aggravating low back pain activity, they should co-contract. We have hormonal changes going on in pregnancy, and they're compensated by an adequate sacroiliac force closure. Stabilizing exercise can reduce pain and enhance functional abilities, but the training program must be individualized and tailored by the physiotherapist according to the results of the clinical assessment. Right. One thing that we can teach them is postural awareness. In addition to hands-on techniques, educational activities like, their posture, that's effective for reducing pain and decreasing stress on the weight-bearing joints and other myofascial structures. Introducing more efficient movement patterns enhances and reinforces the effectiveness of hands-on therapy. When a woman really knows what it feels like to have proper posture, she can catch herself when she gets tired and starts slouching, right? So urinary incontinence in pregnancy, here's some statistics. Urinary incontinence results in a decreased quality of life for 54.3 pregnant women, so more than half have an issue with this. Quality of life of incontinent pregnant women worsens with increasing gestational age to term. So in our last trimester. Pregnant women with urinary incontinence have statistically significant lower quality of life during pregnancy than those without urinary incontinence. Pregnancy-related urinary incontinence increases the risk of permanent incontinence in the postpartum period or later in life. So here's some considerations. Our pelvic floor muscle exercises should be included in first-line conservative management programs for women with stress, urge, or mixed urinary incontinence. Pelvic floor muscle exercises should also be considered first-line treatment of urinary or fecal incontinence in ante and postpartum natal women. Several studies have found that these pelvic floor muscle exercises during and after pregnancy effective in reducing the incidence of urinary incontinence during pregnancy and postpartum and increasing pelvic floor strength. Unfortunately, evidence suggests that nearly 50% of women receive no information about pelvic floor muscle exercises or urinary incontinence during the antenatal and postpartum periods, and over 40% of postpartum women have never heard of pelvic floor muscle exercises, right? Untrained pregnant and postpartum women are unable to simultaneously contract their TA and their pelvic floor muscles when asked to contract them. Pelvic floor muscle therapy is recommended for persistent postpartum urinary grade A or anal grade C incontinence for more than 3 months after delivery. So there are some resources. There's an app for everything these days. The Pregnancy Pelvic Floor Plan, that app is by the Continence Foundation Australia, and they have a tracker on there to see weekly milestones during pregnancy, but it also has great information on pelvic floor health and has options to receive regular reminders. There's another one called Pregnancy Exercise, the weekly workout, and that app is by Oh Baby and based out of Atlanta. And it's very evidence-based. It includes a new exercise every week of pregnancy based on Pilates and yoga and strength training. And there's a gentle birth. That app promotes positive pregnancy and birth experience, includes mindfulness, breathing techniques, affirmations, and hypnosis, and combines evidence-based research. So more of a customized program. And then Mind the Bump is a meditation app geared towards pregnancy and postnatal populations. And it includes different meditations for different periods of time, like the first trimester, all the way through the trimesters, postpartum, all that kind of stuff. So that might be something for that. Then a labor and delivery or constipation, we can do that reverse Kegel. So instead of drawing up, we need to learn how to relax. So tight on top, loose on the bottom if we want to have a bowel movement or a baby. So it can be used for pelvic floor tightness to prepare for labor and delivery or for constipation. So in this one, we would do diaphragmatic breathing, but on the exhale, instead of drawing up, we're going to let it all hang out. So you're going to breathe in, and on the exhale, your tummy's going to come in, and your pelvic floor is going to totally relax, right? So it's kind of hard after you've just been co-contracting this whole time, and now you got to do something different. But some people practice this for labor, and they never get taught how to do the regular one correctly. So unlike the regular Kegel, where we have a towel rolled up or we're sitting on a stability ball and we're co-contracting, this one's okay to do hovering over a toilet where you don't feel your pelvic floor. We want to let it totally relax. Also wanted to show the pelvic floor and what happens during labor, because a lot of people think they're going to get an epidural and lay down and not thinking about the pelvic floor. So, you know, what you got to do. There's a time and a place for everything, but I just want people to consider what's going on with the pelvic floor when they're making their decision, have a little bit more. So I'm showing the pelvic floor muscles with a TheraBand just to show during pregnancy. right? So we have the weight of the baby coming down here. But I think one of the things people don't realize, which is important with labor, is that it's not natural to lay on your back. As you can see, it almost looks like a ramp that the baby would have to come out. Being on all fours would make it easier for the baby to come out. Even sideline would be easier. But like when you're vertical and you have gravity, with every contraction, the pelvic floor muscles get stretched, so they're hard and thick and taut, and then with each uterine contraction, it gets stretched down, and then you get a little break. So this happens in early labor for hours, getting stretched and relaxed, stretch and relax, until you get into active labor, and then you might be every 4 minutes having a minute or minute and a half contraction of stretching these. So by the time you're ready to have the baby, this is all stretched out, and then the baby can just come on out, right? But if you're on your back and you have a contraction, it's like nothing stretching. There's no gravity helping to assist with this, and they don't stretch as much. So if you're afraid of tearing, having an epidural, or being on your back, those things aren't really helpful for stretching the pelvic floor and the perineum in order to have a baby. Okay. So then postnatal, there was a study that showed that basic Pilates instruction at 72 hours after delivery with home program 5 times a week, 3 to 5 reps of 13 exercises for 8 weeks can significantly reduce the postpartum and maternal fatigue in acute postpartum population. The pelvic floor and transverse abdominis and functional bracing of the core, safe to initiate immediately, right? So we can do it right away. It's probably good to do that. So we're going to be doing that lifting up and our transverse abdominis coming in. Initially treat pain to bring it down to manageable levels, and then proceed with restoring function, endurance, and strength, right? We're not going to go 6 to 8 weeks with no exercise. What we mean by that is no jumping and running. Don't get on the trampoline like you're going to do that with your baby the first day after you have your baby, right? So, but honestly, if you're doing newborn care and laundry, etc., right, we can do some pelvic floor exercises very safely. All right, so diastus recti I mentioned earlier. 100% of women have diastus recti abdominis at 35 weeks gestation. Our rectus abdominis is going to move apart, so because the baby's growing in there. And then it decreases to 35 to 39% at 6 months postpartum, right? To feel for this, we can feel right in the center, and then there's no separation if there's one finger in the spot, and you can feel some connective tissue, but there is a separation if you can put 2 to 3 fingers in there. And if it feels squishy in between, yeah, those are your intestines and the viscera in there. So this example, with women, but older men with a beer gut, it's also common. 34 to 65% report low back pain at 1 year postpartum. Mixed evidence implying a link to DRA. Recent studies demonstrate a varying effect of the linea alba with the activation of the abdominal wall. So when you lie on your back is probably the best way to find this, and you're going to place your fingers parallel to the rectus fibers. Keep your fingers pressing down to see if there's a separation. And as you are lying on your back, the best way to feel it is to slowly raise your head and shoulders off the ground and reaching towards your knee with an outstretched arm, right? Or you can have a client do that and reach down while you're feeling. They can reach with both hands. And, but they want to lift their head and their torso as far off from the table. And there's no hernia unless the intestines are coming out. So this separation might not ever come completely together, but it can at least be functional with training. But you can get that back together. I had a separation and I got it back together by doing, you know, some braced, laying on my back and just bracing my abs together while lifting my head off the ground back and forth and doing the co-contraction of my TA and my pelvic floor muscles. And then I started doing leg lifts and heel slides at the same time. And eventually I was able to get that back together. But first we need education to let people know that it exists. Avoid high intra-abdominal pressure with lifting and activities of daily lifting is another, you know, thing to do so you don't get this. Constipation management. If you strain a lot with bowel movements, it increases intra-abdominal pressure. So I guess if you had to, you would want to manually brace your abs. You want to co-contract, functional bracing, and be fitted for supports as needed.